So let's talk breastfeeding and estrogen. Okay. So we do a lot of talk on the channel in perimenopause, menopausal women. We love all women. But there's this interesting phenomenon of breastfeeding moms that when you're breastfeeding, you have low estrogen. And sometimes we need to give them vaginal estrogen to plump up everything back there. Um, so it's not in your head, right? Let's talk about something that many new moms experience and no one actually warns you about, right? So we don't talk to people about perimenopause and menopause. So we certainly don't talk to them about breastfeeding and what could happen to the vagina, okay? You're breastfeeding, you're bonding with your baby, you're doing everything that you think is right, but you're dry. You got nothing. There's pain with sex. It's awful for you. It's itchy for you. Guess what? Breastfeeding induces low estrogen. Okay. It does. That's just what it is. So pregnancy is a high estrogen state. Woo, you have all this estrogen. That's why your breasts hurt. Right. And then boom, you crash and you're breastfeeding and it's a low estrogen state. Okay. So something as simple as vaginal estrogen can actually make you feel like yourself again. Okay. And if you've ever heard me talk at any talk at all, you know vaginal estrogen is very, very safe. Okay. Here's kind of the little bit of the background. When you're breastfeeding, your body prioritizes prolactin. Okay. That is the hormone that drives milk production. But prolactin suppresses ovulation. Okay. And that means your estrogen levels drop. Sometimes they can actually mimic, in some women, that can mimic like a menopausal level. What does that mean for you? So it means vaginal dryness, thin, fragile vaginal tissue, painful sex, can be urinary urgency and frequency, loss of lubrication, burning and itching. I see a lot of women that after having babies have multiple recurrent urinary tract infections. This is why. It's not in your head. It's hormones, man. It's hormones. And it's a shock, right? Because you have these young, healthy women that are like, what is going on? And not only did you just have a baby and you're already stressed and you're up at night and all of these things, but now you got all these vaginal issues. Ugh. What makes it worse is that a lot of times nobody talks to them about it. A lot of times women don't even bring it up. Or they're on multiple antibiotics, which I see, right, for all of these UTIs. No, you may need them, but for the actual infection, but let's figure out why this is happening. Good news is you don't have to suffer. If you are prolonged breastfeeding, you do have these severe vaginal symptoms, low dose estrogen may be a total game changer. Remember, you need to talk to your doctor, your provider. I am a doctor, I'm not your doctor, and everything is individualized, right? But vaginal estrogen can rebuild, moisten that vaginal tissue, improves elasticity, lubrication, reduces pain, itching, and irritation, supports the bladder, and reduces urinary tract infections. It's not systemic, ladies. It's local. It's local, so it's safe during breastfeeding, especially when you're working with a doctor who's monitoring you and watching you, all the time. So this is amazing. Feel empowered. Don't be ashamed of what's happening. You're not broken. You're postpartum and you're under supported. Okay. You're postpartum and you're under supported. You deserve to feel comfortable, confident, and connected to your body, especially now. So there's no need to sit and suffer in silence. Okay. Okay. So subscribe to the channel. Don't be left out of this conversation. Tell all your friends. Tell all your friends. We need empowerment. We need empowerment. Women's health is so important, okay? Don't sit there in silence, ladies. There is help. We can get you vaginal estrogen. It will be a game changer. Find a provider who will. Talk about it. It doesn't even matter about the provider if you don't talk about it. We gotta talk about it. Talk about it, talk about it, talk about it. Watch my video, like and subscribe. Watch my video on vaginal estrogen and its safety, and share with everybody, okay? Because you don't need to suffer in silence. Until next time.